two separate things we have to look at. There's institutional Medicaid, which is when someone goes to the nursing home, or there's home and community-based Medicaid. And let's face it, people want to get their care at home. But there's 4 very specific criteria under your primary health insurance that you must meet. And the first one is you have to require a skilled service. That's anything that requires a licensed professional, like a nurse or a physical therapist or an occupational therapist. The second one is you must require hands-on care. While hands-on care is a little more restrictive, you must require physical assistance with the task. You also must be considered homebound, physically unable to leave your home without substantial assistance. And a wheelchair is not necessarily substantial assistance. And the last one is your care must be considered restorative. You need to be showing signs of improvement. So let's say if someone had some surgery and they went home and the discharge planner says, I don't like the looks of that wound. They make a referral to the public health nurse. She comes out and says, okay, I need to change the dressing twice a week. Well, that is something the nurse has to do. She sees you meet the other criteria, so she puts a home health aide in place, and that person's going to come out and help you with some laundry, maybe some personal care. But then 4 or 5 weeks later, what's happening with that wound? Hopefully it's healing. So now the nurse says, well, everything is looking good, you don't need nursing services anymore, you're discharged from nursing care. Well, what happens to that home health aide service? You're going to be discharged from that also, because you no longer require that skilled care requirement. Doesn't mean you don't need the care anymore, it just means that you've exhausted your insurance benefit. So that's when the next option would be Medicaid. But when we're talking about home and community-based Medicaid, the limits are very, very low because it's very income and asset restricted. And just at a very high level, I'm not going to give any financial advice, but in Wisconsin, the limit for Medicaid is income is $924 a month. That's a pretty low bar. And income means everything: Social Security, pension, dividends, all of that. So the big problem with home care is most people aren't going to meet that home and community-based Medicaid. There are some available in Wisconsin, what we call waiver programs, but they also have waiting lists, and it's a little bit more restrictive. The waiting list is the big problem. A lot of times people have to wait. Well, when you need care, right? So it's hard to do that.